part of ACT grants, all of us came together in the month of March last year to put together a team, a set of volunteers to work towards fighting against COVID. So, when we realized that India is not yet ready to fight against COVID and COVID is coming to India, all the ecosystem players within the startup ecosystem, that is founders, entrepreneurs, senior leaders in the startup ecosystem, venture capitalists, then also many foundations that work with these companies, all of us came together and we said we need to get together and fight against this disease and help whatever way possible the government to be ready to tackle, because this was coming at a pace and it was expected to spread across India, and this is we are talking about in March of last year, and that is the reason we all came together. And we knew that we are a small player in this large disease and we had some core skills and we thought we will do something that where we know all together in the startup ecosystem and try to fight this disease. When we all came together, there were three parts in our strategy. One, we knew that any solution we bring to the table, only way that can create any impact is through working with the government. Step 2, the second team was formed to say in order to even experiment we need money. So, a team was formed to raise money from India as well as global philanthropic foundations as well as individuals. The third group was to go and actually find companies that would take these grants and translate into solution, and that solution can be demonstrated that it has impact on the field in a small way, and if so work with the government to take these solutions across India. When we looked at the type of companies that we need to give grants to, we followed the playbook that most of the accelerators, incubators and investors community that in India already knows. So, basically we looked for high intent, high caliber people who wanted to solve this problem, and secondly we made a decision to give them small grants fast, so that they can take the money and demonstrate the solution would work or not. And thirdly, once the proof is there, then we gave additional grants for them to scale. And by the way, in every aspect of that, we made sure that each of these companies, the grantee companies, also has a government partner or a hospital partner, so that they can work together to have a realistic data rather than just a lab solution. And these few things we did helped us a lot. So, we did 3-step process. Step 1, anticipate what the government needs in the next. So, we first gave grants to those companies that are required at scale in the future, and 2, as we said, quickly give grants, so that most of the grants were given in less than a week, and so that they can show solution, and 3, find a government partner. And in that context, we had so far we have created 10 tracks, and our tracks graduated from step A, B, C, D in terms of how the disease progressed. This has been an extraordinary effort, starting from March all the way today. 100 plus volunteers came together in the very first equation. That is how it started. Then these 100 plus volunteers looked at 2000 plus grantee potential applications, and out of those 2000 we have given grants to approximately 60 plus companies. And these 60 plus companies, after the initial grant, we have given them second and third grants to many of them, where I think total number of grants is 120 plus. Out of 100 crores, we have deployed I would say around 85 crores, approximately 85 crores in this equation. And this, we have worked with almost all states across India. These companies have been working with every state. And by the way, not only that, there are more than 300 plus districts where we have created impact one way or the other. So overall, this has been an extraordinary effort from every startup, every investors, every foundation, that we all came together on a common cause, saying that what we can do to help identify these great set of ideas and solutions, give them initial grants to see that whether they can show a solution, and if so, work with the government and see 1 or 2 months of effort. Post that, government deciding to scale with these companies, and this has been our journey so far. We are very glad to say that we were the first early grant giving to creation of Swasth, and we committed a significant portion of our grants, up to 10% of our grant money towards Swasth, and Swasth had a strong following from the ecosystem, from the government, and now we are very happy and excited about how that group has become an independent Section 8 company and is able to go after large India based problem and continuing to take on at an India scale problem and help connect all the hospitals and connect all the data, connect all the doctors, connect all the insurance providers. It's a massive program. I'm happy to say that it is working very closely with the government and a lot more volunteers participating in it. That's one big outcome that we saw in this effort. I'm happy to announce that we have created a 2020 impact report of ACT grants that summarizes all of the activities that the startup ecosystem did with the grants, with the foundations, with the government and the volunteers together against COVID. And this report, which we have, we are very excited to launch today. This report has every one of the tracks, every one of the grantee companies and their impact, their real on the ground stories and what they learned from it, and all packaged, including the work we did with all the government districts, the IAS officers, extraordinary support from the government to all come together and create this wonderful report that gives us summary of all of us, how things came together to fight against this COVID. Love to get your feedback, love to get your input on this as we make progress on this disease and as we start planning out our ACT grants 2.0 in the future about how this translates into our activities for social good and how we all become entrepreneurs for social good in as what we call as co-founders for social good in the coming days. Please download this report. Has got a ton of information about all of the work we have done, and it will be great to get your feedback as well as participation.
Welcome everyone. We have a great panel discussion ahead of us with wonderful panelists. I'll start with Meena Ganesh. Meena is the MD and the CEO of Portia Medical. It's India's largest and fastest growing home healthcare company, which she co-founded in 2013. Welcome, Meena. Next, we have Dr. Dhruv Joshi. Dhruv is the co-founder and CEO of Cloud Physicians, India's leading remote ICU solutions provider. He's a pulmonary and critical care specialist who trained at the Cleveland Clinic after graduating from St. John's Medical College, Bangalore. Dhruv, welcome to the panel. Next, Nachiket Moore. Nachiket is an economist by training with a focus on health systems design. His current work is principally focused on the design of national and regional health systems. He is a visiting scientist at the Banyan Academy of Leadership in Mental Health and a senior research fellow at the Center for Information Technology and Public Policy at IIIT Bangalore. Nachiket, welcome. Next, Prachi Winless. Prachi is the director for India programs at the Michael and Susan Dell Foundation and manages a portfolio of startups, NGOs, and large-scale government partnerships. Prachi has led the MSDF engagement in ACT, And even though her passion is education, we have turned her into a healthcare expert. Welcome, Prachi. So, Nachiket, I'll start with you. You know, you were one of the people that got involved with ACT very early in terms of defining what should our approach be and so on. And given that you've been there from the start, I thought it would be very good to get your perspective on ACT's role in fighting COVID-19. And what was the thing about this approach that really made it unique?
So the idea of ACT came about because a number of concerned private equity players, startup entrepreneurs felt that the country was in a stage of crisis and that all hands on deck were required to help how they can. Obviously, we realized that the government had a principal role to play and that any effort that anybody else put together was going to assist wherever we can help. I think at that point, it was not so clear how we will have an impact, but the desire was to have an impact. It turned out rapidly, though, that there were many areas in which, while the government had good intent and good desire, the country did not have all the technological capabilities or the platforms that were needed to even help the government sort some of this out. The ability of the ACT team, the private equity players, the teams of volunteers that came together at one point, more than 100 people, rapidly sifting through, because we started getting hundreds of applications for people who, had wonderful ideas, had thought about some innovation that could be put to market quickly, but somebody has to evaluate. Does it make sense? Does it not make sense? Will it work? And this is really what ACT, I think, did in an exemplary way.
Thanks, Nachiket. Meena, you were one of those bright people who sort of took the clarion call and said, I need to get involved with, responding to the disease. And I know that it wasn't just with ACT. I know you did a bunch of other work in terms of, feeding people and so on. So just want to get your perspective. What got you interested in ACT? How did you see the work that we were doing and how sort of take it forward?
So this was very early on when early in the pandemic and Prashant Prakash had reached out to me and said, this is something that we are trying to put together. Immediately it struck a chord. And so we said that absolutely we need to be part of this in some way or fashion. And our little modest contribution that we could make, we immediately did. But thereafter, as I started to look at the magnitude of the problem, I also seeing what kind of solutions can we provide other than the funding that we can provide. So that's when the first set of conversations started to happen with one of the state governments. And while the governments were trying to create enough of beds in hospitals, enough of oxygen and ICU set up and ventilators or just COVID care centers, it rapidly started to emerge that not everybody needs to go into a hospital. A large portion of people who are either asymptomatic or mildly symptomatic could very well be managed at home and ensure that they are following the protocols, they are well, and if they're not well, perhaps provide them with some doctor support. And if they genuinely are not well, then they need to be, of course, transported to the hospital and appropriate action needs to be taken. So early, towards the end of April, we had created this whole solution protocol. One of the state governments showed interest. We started to work with them. And as we did that, then we realized that this is really something which a lot of other states could benefit from. And that's when ACT really helped us in both thinking of how we could ramp this up. They had connects with a lot of state governments. So there were people who are literally our ambassadors or the ambassadors of the solution to go and talk to the various states and say, hey, probably this will help you. Why don't you pilot this? Or why don't you take this on? So moving from one state, we rapidly went on to serve 7 states, thanks to the help that ACT provided.
I think you bring up a very important point that I think in some ways ACT has allowed the private sector to sort of shine the light on new protocols of care. And I think the point you make about the fact that, at-home care is not in the normal scheme of things for government sort of care delivery is something we should be looking at. And I think some of the work that you did with the BMC, for example, is bringing that forward. Prachi, I want to turn to you. And as I said, you were as Dell, as MSDF, the focus was on education, livelihood, and everything before COVID happened, right? What was your perspective? Why ACT? Why did you decide to work with ACT? What was and what has your sort of experience been?
The sense of urgency with which this platform had come together has been the biggest attraction for us to participate and fund this platform. In the very early days, if I'm not wrong, within 3 or 4 weeks of the lockdown, the platform was already together, not just as an idea, but as a real functioning platform, which had a serious amount of funding committed, a very good point of view on what India will need, and also a good esteemed set of experts who were going to guide the journey. So the speed at which it happened was really what was the most attractive thing for us. And throughout our journey, we've been now partners since the beginning with ACT. That sense of urgency has continued. We have seen that, every time as the pandemic has shown us areas which need interventions, or, as the nature has changed, as the geography has changed, as the need area has changed, the platform has very quickly come up to speed, both in terms of forming an informed opinion on what needs to be done, but also in terms of creating that excitement in entrepreneurs, many of whom are on the panel today, to say, okay, what can be done? So this for us was the most attractive.
Dhruv, would love to understand, given your experience, what were the issues that you faced? What were the challenges? And how did you see ACT play a role in addressing some of these issues?
So just a brief background on what we do at Cloud Physician. At Cloud Physician, we're addressing the shortage of ICU specialist doctors in hospitals. And we do that using technology. This was a problem that we had been addressing even before the onset of COVID over the past year. However, I think over the past year with COVID upon us, this existing gap in healthcare delivery was had a light shown on it. So it was very clear to everybody that while this was already an existing problem, it was further exacerbated because of the surge of patients in ICUs. Now, if you look at the way that this problem had been being addressed, it had been addressed traditionally by the traditional models of healthcare delivery, which unfortunately have not worked. And that was the reason why we even started Cloud Physician way back in 2017. And one of the challenges that we faced in our initial days of starting Cloud Physician was, does this new model of delivery, this technology-enabled model of delivery of healthcare in the ICU, does it even work? Now, over the past year, working closely with ACT, when we realized that these government hospitals facing the surge of patients are not going to be able to cope with their traditional models, we were able to quickly deploy this technology-enabled model. And looking back now, I believe that we have enough data to show that this technology-enabled model does work. And I think that ACT's role in the past year or so, or little less than a year, I think ACT should take great pride in the fact that they played no small role in this change. When you look back, I think at some point in time in the evolution of models of healthcare delivery, I think in many ways this period that we are in will be looked at as an inflection point.
This goes back to, I think, a point you made, right? That there are sort of fundamental shifts that are required in healthcare delivery, and you mentioned home healthcare being a significant sort of aspect of that. In your interaction through ACT, working with the governments, what were your, were there any changes that were required in your model, or as you worked with the government, anything that came out that you said, okay, if I want to scale this and go, as you said, you worked across 7 states. Now I want to go across all the states of India. Were there any things that came out where ACT and we can work together to sort of scale this up?
The ACT team helped us understand that having this platform now will enable us to do the same thing. I mean, it's not just a COVID care, it's a treatment management platform that can be used for any disease that requires long-term monitoring, that can benefit from remote plus community plus at home plus facility-based care. You can bring all of these pieces together. I think that's really what we managed to create as a result of the support that we got from ACT and also the work that we've done with multiple states. It's given us that understanding now.
Prachi, I just want to sort of, maybe talk a little bit over here about your work with livelihoods. What is your perspective going forward? How will healthcare and livelihoods interact? What is the way that we can sort of integrate the two, particularly as we look at sort of rural markets and migrant labor and so on?
Two things which are great things which are coming out of all of our learnings through the ACT work. One is that we are, through our work, uncovering a lot of deep systemic issues in our working, right, which also need to be solved. So today our view might be here and now COVID response, but now getting a deeper understanding of the system, we are also understanding that, there are, pandemic is a here and now, never seen before kind of a health challenge, but we have our own set of very large health challenges in India. And we are coming up with some of those solutions as well. So I think, in the healthcare, the journey which will continue for us is with the same set of, collaborative partners that we have, how can we actually shift gears towards now solving problems in a longer, deeper, sustained way going forward. The other thing in which, livelihoods, we have started through ACT, the work that we have started doing in all these job platforms, right, where we are interconnecting we are connecting the supply and the demand in a way which has never been done before, making that data available and actioning on that data through a very seamless technology is something that we find very exciting. We've seen several governments use it very extensively and finding it very useful.
So, Nachiket, we talked about technology as a platform, and I know that one of the initiatives that ACT backed around technology was Swasth. And I know that now Swasth is working very closely with the government in digitization. So what is the path forward with what we are doing with Swasth, and how do you see the interaction with ACT?
What Swasth is doing now is going back to the original reason why we got into it, which is to understand what is the systemic impact that we can create. The core idea that Swasth believes is that there is a lot of latent capacity on the ground. Like Dhruv mentioned, there are hospitals. Like Meena mentions, there are on the ground people that one can train to offer good services for in-home services. You don't necessarily need to import them all from one place or another. Right? What is needed is incremental value add to these players. We believe, for example, that there are 10 lakh primary care providers in the country. In fact, as it turns out, even in small towns, there are hospitals. It's not as if there is no hospital. It needs capacity enhancement, but the facility is there, the MBBS doctor is there. Similarly, if you go further out, a non-profit, for-profit, or a government facility exists. So what Swasth is doing is focusing its efforts on enhancing the capability of this last mile provider, either at a hospital, small nursing home, or primary care provider. To up the level of service that they can provide with the help of technology. If they need equipment, like we saw the oxygen concentrator, can we give them access initially to some charitable sources, but eventually to good ways in which they can acquire it? If they need training, can they get training? If they need access to electronic health records, but they don't have the money to invest in them, can Swasth build something in partnership with multiple players and then offer it for nearly free to these 5-10 lakh players on the ground? The other direction that Swasth is going, which also is intended to have the same impact, what Swasth discovered fairly quickly is that there is a lot of infrastructure in the country. There are insurance companies, for example, that are there, TPAs that are there, health technology providers that are there, but they are not talking to each other properly. The data is not flowing smoothly, claims processing is becoming very long. As a result, even if a poor person got access to some form of insurance, to actually get the claims process became fundamental. Swasth, because of its unique positioning, is gradually emerging as a standard setting platform. So its most recent effort, 50 large insurance companies, small insurance companies, TPAs, hospitals have come together to set up a health claims processing platform. The National Health Authority has said that they will now work with these standards, because if providers, insurers like it, then they will also build their software according to it. We are now in the process of talking to the insurance regulator to see if those standards can become then a truly national standard. It's another powerful role that a non-profit entity like Swasth can play, which can have a systemic impact and eventually go out there and have an impact on the ground. Swasth has also taken some remote areas like Gadchiroli, like Melghat, like Bilaspur in Chhattisgarh, to see how, using all of this capacity, can it transform the practice of healthcare, whether by government, whether by non-profits, whether by for-profits, on the ground for entire districts. So Gadchiroli has 1 million population. Right? It's a tractable, not small, but not too large population. They have a good partner in Search, which is a local NGO there. How can we enhance or bring all this technology and digits to that group so that these 1 million people can live better lives? So, these are some of the ways in which Swasth is trying to build, to what Prachi was saying, a long-term systemic response.
Looking forward to partnering with you on the next phase of the journey. I think there is a lot of work to be done, as you said, and I think there is a backbone requirement. We have built a strong relationship with the government at this point, and not just the government, I would say civil society at large. So we have NGOs that are working closely with us now. Satwa has played a big role in building that bridge with the NGO sector. We have obviously all of us have had very good relationships with the entrepreneurs and the overall sort of innovation ecosystem. We continue to see a lot of activity happening in that space. One thing that Meena mentioned was around vaccination. So we have actually received a lot of interest from people who are trying to solve various parts of the vaccination solution, right? So there is everything from how do you monitor the administration of the vaccine? So that's technology, right? How do you make sure that the vaccine gets to a particular location, which may be remote, and make sure that it's still effective, right? So temperature control and so on. So we are also looking at solutions in that area. When you use a syringe, that syringe is still, it's biohazard. There's, it's got a live sort of vaccine in it. So how do you dispose of it? So there's, again, people are building technologies around that. So I think there is a lot of activity still happening. There's a lot of work still to be done. And, vaccination is clearly one area where we're just getting started, right? There is a lot of work to be done in this space. So obviously we will start with, continue with that next, and then go into other areas. So thank you everyone for your time. It was a real pleasure to moderate this and hear your thoughts, and thank you again for your support for ACT and being part of the journey with us. COVID is not over yet. We still have a lot of work ahead of us when it comes to vaccination. There are still concerns around new mutations of the virus that we have to address. So ACT will continue working on COVID response with our partners, with our volunteers. But we are also seeing that there is a need for healthcare interventions more systematically and across many other areas. So for example, when it comes to primary access, there is a major issue where the government wants to provide more primary access, but doesn't have all the innovation available to it. So what we see is an opportunity to take our learnings from ACT 1.0, this COVID response that we have worked on jointly over the last 1 year, and take that same energy, that same urgency into other areas of healthcare. We have identified 3 or 4 areas that we think will be important for us. Tuberculosis remains a major problem. The number of deaths, the numbers I've heard are close to almost 4 lakh people a year, which is, if you compare it, COVID, we've had 1.5 lakh deaths. So that's a much larger problem that we have to address. The second area is mental health. This is one area that we saw during COVID as well, and we expect that it's not getting any better, so there has to be interventions over there. The third area where we see a big gap right now is the diagnosis as well as treatment for cancer. And in cancer, whether it is breast cancer, whether it is cervical cancer, whether it is oral cancer, the incidence is increasing. And it's very important that we all work on this together. So if I look back at our response and what has worked for us, number one, we have seen that you can bring private innovation and government delivery together. It was, as some of the panelists mentioned in the discussion, they saw a huge outreach from the government to work closely, and it was pleasantly surprising that the government actually reached out to us. And we expect that we can continue this partnership going forward across some of the areas that we have identified. What is the nature of this partnership? We expect that private innovation is driven by technology. So our underlying thesis is really about technology-led innovation and building platforms that can actually provide solutions at scale. So we will continue to drive that. Telemedicine, healthcare worker training, and so on are all areas which are fundamental platforms that will need to get built to provide these solutions. We have seen, and we continue to believe, that as a tech innovator, as a venture capitalist, as a volunteer, we are all co-founders of social change. And in that scenario, we believe that we can all work together to bring change at scale.